When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
Hi, everybody. A very, very good afternoon. Thank you for joining us here today on a presentation prepared for you, especially on labor and delivery. Let me start with saying a very, very warm thank you to Dr. Meera Agarwal and the entire team of Agarwal Nursing Home for giving us this opportunity to talk to you on this afternoon. Very big thank you to the Cordlife team. So Cordlife is one of India's leading stem cell banks, and they have been actively organizing these webinars right from the beginning of April, which has been the start of our pandemic. All our mamas have not been able to come in groups. We have not been able to organize these classes physically. So thanks to Cordlife team, we have been given this platform and we are able to conduct all the sessions online for you. My name is Sonali Shivlani, and I have been a pregnancy and postnatal consultant for almost 17 years, based out of Mumbai, and have had the privilege of doing multiple such sessions for Agarwal Nursing Home, even physically in the past. So this has been a regular practice sponsored by the Cordlife team and Agarwal Nursing Home, and I have been conducting the sessions. The program that we offer for all of you is 3 topics. So the first was diet, nutrition, and exercise during pregnancy, which happened on the 3rd of January. I'm hoping that all of you have had the opportunity to attend it. The second session in this series is labor and delivery. So we are going to be talking about what happens during labor, how to cope with the pains, what are the options that you have today, and including your breathing exercises, labor positions, etc. And the third session in this series is going to happen on the 31st of January, which is going to talk about life after baby. So newborn care, breastfeeding, all of these areas will be covered. So it's actually an entire antenatal package. One of the additional benefits is that all of you have been added to a special group which was created by Radhika of Agarwal Nursing Home. And every morning I have been sharing a tip of the day with all of you. So that gives you some additional learning. It gives you a little bit more of connect with all of us. So I'm hoping that you're enjoying being a part of that group as well. Right? So a little bit more about myself. I'm internationally certified. I have been doing this for 17 years, worked with more than 35,000 parents, and I'm a parent myself to 2 wonderful kids whom now I can't call kids because they're adults. So my son turned 20 last year. My daughter's turned 18. So it's been a journey, and I've enjoyed parenting them more than anything else. So it's been a wonderful experience. A little bit about how this session is going to work. If you have realized, all of you have been kept on mute. So you're not going to be able to use your microphones during the session, but that doesn't mean you can't ask questions. Please put in all your questions in the question box, which is there in the window next to you on the dashboard. So you can put all your questions there. I will make sure that I answer all of your questions before I close this session. So this is something that is important. You need to be comfortable. You need to be relaxed. Take as many pillows as you want. Make sure you have that bottle of water next to you. And let's get started. We are going to talk today about labor and delivery. I think one of the most worrisome topics for most mothers. I think whenever I talk about labor and delivery, a smile comes to my face, and it's not because it's, oh my God, I managed to go through all that pain. But what comes to mind is the first few thoughts that I had when I was pregnant the first time. So when I was pregnant the first time and I saw those two lines on that pea stick at home, besides the excitement, of course, and I want to share this news with everybody, there was one more thought which came in my mind and it was very instantaneous. God, please let me have twins. Because I always wanted two kids and I did not want two labors. Because just like you, I was going to be a first time mother and I was scared of the pain, of the discomfort, of all the horror stories that I had heard from all the parents around. Fortunately, God was good and I had this amazing birth experience which lasted for little less than 2 hours, and a nice 3.5 kilo baby, which was my good fortune. The smile continues because the second time that I saw that pea stick, this time my first thought was, oh God, let it not be twins, right? Because I wanted two, I did not want three. So that's how labor is, that's how birth is. It's a little different for everybody. And that's what we're here to talk about, to understand what are the things which make labor and delivery a more enjoyable, pleasurable, smiling experience for all of you out there, right? Let's get started. All right, before I even begin, this session is going to be recorded. So the Cordlife team will be in touch with you in about 48 to 72 hours and will share the recording of this session. So you will have this for reference. I'm actually hoping that your husband, your partner is also there with you to kind of, be a part and parcel of attending this webinar so that they can be a good support system for you as well. Okay. All right. So let's get started. So pregnancy. And I know we discussed a little bit about this in our previous session, but I would just like to kind of, connect the threads again. So pregnancy stands on 4 pillars, which also obviously prepares your body for labor and birth. So the first is a healthy diet. The second is regular exercise. The third is staying away from myths. And the fourth is being absolutely relaxed and stress-free. Because when I take stress, when I take tension, I slow things down, right? So now let's understand how this can get interwoven into how your labor and delivery experience is. So when we talk about a healthy diet, of course, I know I discussed this in a lot of detail in the last session. It is going to help to nourish your baby. It is going to keep you healthy, and it will also build your immunity, which is very important, especially now in this COVID phase, that you need to make sure that your immune system is also well developed. So remember my balanced diet, those 5 fingers that I spoke to you about last time. Make sure that your main meals are a balanced diet. Pregnancy means maintaining your sugar levels. So you need to eat every 2-3 hours when you're awake. You don't need to get up every 2-3 hours at night to eat. But during the daytime, when you're awake, eat every 2-3 hours. Water is very, very important. So 10 to 12 glasses of fluid intake, which is predominantly water, is what is highly recommended because it not only helps to hydrate you, but it also helps to digest your food and it helps to maintain the amniotic fluid levels. Amniotic fluid levels contribute to when your delivery will happen. So the date of your delivery can become preterm if the fluid levels drop. So having a preterm baby is going to have its own complications and we don't want that. So even if there is frequent urination issues, make sure that you're having adequate fluid intake. Take all your prenatal supplements. This one's really, really important. We just have 9 short months to make that perfect baby. If any of your supplements does not suit you, please inform your doctor so that the doctor can change the supplement and give you something which is more favorable for you. But just because, a supplement makes you feel bloated or makes you feel nauseous or, is kind of making you throw up, doesn't mean that you stop taking it. Exercise is going to prepare your body for labor. It's going to reduce your aches and pains. It will help to relax you, help you to sleep better, and it also helps in overall fetal development. We discussed a lot of these in detail last time, and I even taught you various exercise postures, which I hope you have consulted the doctor and you have started doing them as well. The safest exercise is walking. So if you can't, find a regular exercise class which is supervised, you can definitely start walking. You do not need to worry that, oh my God, I can't join an antenatal class. I'm not comfortable with an online version, whatever. But you can definitely walk. So remember, walking should happen on a regular basis, 30 to 45 minutes every day. Wear comfortable, loose cotton clothes and also wear good shoes. Eat a small snack before you go and carry a bottle of water so that you stay well hydrated. Walking should be at a pace which is like a little bit more fast. It should not be like a stroll. So always focus on your walking. Follow a pace where your heartbeat is slightly elevated, but you're not breathless. So that's the goal, right? Any kind of antenatal exercises should be with supervision. And if you can, it's good to include some breathing exercises in your routine as well. As I showed you last time, and just as a refresher and reminder, these are some exercises that you should do in the last third trimester, right? In the last 12 weeks of pregnancy. So do your squats regularly. We start with 8 to 10 and build up to anywhere between 32 to 40 squats every day. Sit in a butterfly position whenever possible, whether it's to watch television, whether it's to, talk on the phone. Do your leg raises. Do it on a non-slip yoga mat so that your body is stable. Remember your Kegels. Do not do them in the bathroom, but do them at all other times during the day because it helps to prepare your pelvic floor. And last but not the least, deep breathing, about 30 to 40 deep breaths every day in a non-air conditioned environment is highly recommended. All of these exercises are not going to take you more than 10 to 12 minutes on a daily basis, and you should be doing them every day from week 28 onwards. Once your doctor gives you the green signal, once your doctor gives you the permission. If you are not allowed to exercise, then please don't start these because they could result in early labor, preterm contractions, other complications if the pregnancy is complicated. But if the pregnancy is normal, then these exercises will actually prepare your body for labor and delivery. Full term is considered to be between week 37 to week 40, which means that we definitely don't want the baby to come before that. There are many times I've heard mothers being told that, Nawa mahina lag gaya, abhi chalega. The 9th month starts at week 35, but we do not consider that as full term. At week 35, the baby's lungs start maturing, but the baby's lungs are fully mature only after week 37. So if the baby comes at week 35, which is the 9th month, the baby could still need the NICU for breathing difficulties, etc. So as far as possible, we need to sustain the pregnancy for a period of minimum 37 weeks, which is considered to be full term. If you see any of my pre-labor signs, and I'm going to discuss a lot of them now, before week 37, you should immediately report to the doctor. Sometimes mothers see the signs early, 32, 33 weeks also. Sometimes when you're doing exercises, you might notice some of the, discomforts. So you should inform the doctor. So stop doing all of those exercises, stop doing whatever activity you're doing and report to the doctor. Because even at this point of time, there is a good possibility that the doctor will be able to give you some medications to slow labor down or to stop labor. But if you wait and sit and think about it too much at home, then it can become a problem. And if the mouth of the uterus, which is the cervix, opens extensively, then we can't stitch it closed, at such a late date. So inform the doctor immediately. Go in for a checkup. Doesn't matter if it is in between your regular visits. It's perfectly okay. So here are the signs that you can expect. And we're going to start with 15 days in advance. So let's say that the expected due date given to you as per your last menstrual cycle is the 31st of January. This is one due date that you have, right? You have been getting regular sonograms done. And in the sonogram, the date currently the doctor has written 25th of January. This is normal, plus or minus 15 days from the expected due date as per LMP. The expected due date as per sonography can differ. So we don't worry about that. Okay. This is your second due date. There is a third due date. And this is the date that the baby has decided. This is the date that your body has decided. No one knows this date. But your body will give you signs and symptoms 15 days prior to this date. So don't expect that you will get these signs and symptoms from the 15th of January or from the 10th of January. It's not like that. It is going to be basis the date that the baby and the body have decided. So this could be anything. So if you see these signs and if it is 15 days prior to your due date, as per sonography or as per your last menstrual period, then it's all fine. But if it is more than that, then you should let your doctor know. Okay. So the first thing that will happen is that the baby's head is going to drop. Now let me show you what that means. Okay. This is a pelvis. This is a normal pelvis, and this is a baby. So I have my baby doll who's come here for the demonstration today as well. So in the 9th month, the baby's head is down, but the head is still not inside the pelvis. So the head is still considered to be floating, right? In the 9th month, the baby's head is going to be like this, but in the last 15 days, when the baby is getting ready for the delivery, the baby's head is going to drop. And we call this fetal head engagement, which means now the baby's head is locked, fixed, engaged, dropped. It's inside the pelvis. It's very difficult now for this baby to turn around and get into any malposition, which is a good thing. So we're very happy when we see the head drop. You will come to know about this even by the way your stomach looks. So your stomach might appear like a watermelon all the way till your ribs. You might find it difficult to breathe, difficult to eat, a lot of acidity in the 9th month, which is normal. But in the last 15 days, when the head drops, when the head engages, your stomach now starts looking like a pear. There's more weight in the lower part of your abdomen. It's difficult for you to walk. You start feeling more frequent urination, a lot of pressure in the vagina, sometimes sharp shooting pains also. But on the other side of the spectrum, your acidity is reduced, your ribs are feeling more comfortable, your appetite is better, right? You might also notice an increase in Braxton Hicks contractions. Now, Braxton Hicks contractions are fake contractions, and they're called fake only because they do not open the mouth of the uterus. So if you are getting tightening of the stomach, which is painless, short, sporadic, with no pattern, then these are your Braxton Hicks contractions. And in the last 15 days before the baby is supposed to make an appearance, you will notice that the number of Braxton Hicks contractions increases. So earlier you may not notice them, but now suddenly you're like, oh, my stomach is tight. Oh, my stomach is tight. What's happening? So this is something which is really, really normal. Then you have cervical changes, which only a doctor will be able to ascertain. So when you're going for your checkups, even in early pregnancy, even in the second trimester, your doctor palpitates your abdomen, right? Now, when you go in the last few weeks of pregnancy, the doctor starts palpitating your lower abdomen right between your legs. You know, the palpitations are there, and the doctor's trying to check if the baby's head has entered into the pelvis or not. If the doctor finds that yes, the baby's head has entered into the pelvis, the doctor will do an internal examination with 2 gloved fingers and will check the cervix. I'm going to kind of, mention what the cervix is here. Your cervix is the mouth of the uterus, which opens in the vagina. During pregnancy, it's long, thick, and it's tightly closed. So in some senses, it also looks like this. Long, thick, and tightly closed. And in the last 15 days, the cervix kind of starts becoming softer, thinner, shorter. All of these things start happening. So the body starts giving these signs, symptoms, changes almost 2 weeks before the actual birth. And then, yay, we have something which happens even 48 hours prior to labor. So as I told you, there's this cervix right here at the mouth of the uterus, which is long, thick, and tightly closed. If you can see my cursor, I've pointed it out. This cervix is also blocked with what is called mucus. And in the last 48 to 72 hours, you might notice a lot of mucousy discharge, which is normal. So we don't worry about it. Another thing that can happen is this bloody show. So if you're seeing pinkish brownish discharge along with the mucus, then this is also considered to be a sign which could be that labor is going to happen really soon. Most mothers will also report loose motions or multiple bowel movements in the last 2 days before the actual onset of labor, which is another normal symptom. Because what is happening is that in this pelvis, we have three organs. We have your bladder, we have your uterus, and we also have your bowels. So nature has designed it as that as the baby's head is pushing down, the bowels try to empty out so that there's more space for the baby. The next thing that you might notice is spasmic back pain. So far when you get back pain during pregnancy, it's just heaviness. You get a massage, you change position, you rest, the backache subsides. But now suddenly you get like a spasm, which grips your lower back, which makes you feel really ouch kind of a feeling, and then it completely disappears. So that is something which happens in the last 2 to 3 days before the onset of actual labor contractions. Now, in spite of all of this discomfort, you have a lot of energy. Energy levels are like at an all-time high. And that is something which is really important to keep in mind, that do not waste your energy. Do not use it up in all sorts of other activities, even though you might want to. You might think that you can conquer Mount Everest at this point of time because your lethargy of the ninth one suddenly disappears. But this is nature's way of giving you more energy to cope with what is going to happen really soon. Then you have the onset of labor. And with the onset of labor, you have regular contractions. So you have to kind of keep a chart. You have to start timing the contractions so that you can make a mention of it to the doctor, of the pattern, of the rhythm, of the durations. They will feel like your period cramps. So the lower abdomen kind of has that intense crampy kind of a feeling. Maybe that you've got bouts of diarrhea. So that kind of loose motion feeling, cramp feeling in the abdomen is very normal when actual labor starts. In early labor, the contractions are going to be far apart and the intensity is going to be mild. But as labor increases and you're getting closer and closer to the delivery, the number of contractions coming every hour will go on increasing. So the frequency increases and the intensity also becomes almost difficult to manage. You have to remember that activity is going to increase the intensity. So if I feel a contraction, if I walk around and it becomes more severe, that is a good possibility that this is real labor. But if I have a contraction and if I walk around and my contraction reduces, settles down, becomes milder, then it's quite possible that this is a false alarm. So you might want to kind of do a little self-check before you wake up your family, before you kind of rush off to the hospital. For 1 or 2 contractions, just try to walk around and see what happens. If the intensity reduces, maybe you could just rest and see if they subside. This is how you have to time contractions. Your doctor is going to want to know 2 numbers. So if you look at it, the first one is duration, which basically is measured from the start of the contraction, as you can see over here, to the end of that contraction, right? So you make a note of the duration, that is how long each contraction is lasting. You are going to have a break where there is no pain, no contraction. So this is also known as the period of relaxation. Very important, right? And then you have the frequency. This is the second number that the doctor will ask you, which is measured from the start of one contraction to the start of the next contraction. So this is noted as your frequency. Whenever you call your doctor, the doctor is going to ask you these 2 questions. What is the frequency? What is the duration? So suppose if you tell the doctor that, my contractions are coming every 1 hour apart and they're lasting for like 10 seconds, you're in very early labor and you will do well to stay at home. But if you call your doctor and say, my contractions are coming every 15 minutes apart, they're lasting for 45 seconds, you are well along. And then the doctor will recommend that you should come into the hospital and be monitored, be checked, and all of those things. The best time to head to the hospital is when your contractions are about 20 minutes apart. Most mothers are going to take some time even after this. 6 to 7 hours is quite common even after this stage. So you have time. But this is what is common. That doesn't mean that this is what is going to happen. So please, be alert. And if you feel that the contractions are progressing very rapidly, and you've gone from 45-minute apart contraction to 20-minute apart contractions in like 30 minutes, then you better go to the hospital ASAP and don't wait. If your water bag breaks, so the water bag is, your sterile environment of the baby. As the baby's head pushes down, as more pressure on the pelvis, the water bag can break. So if you feel a gush of water, if you feel a trickle of water, then that could be the breaking of the water bag. And this means that the baby's sterile environment is now open. It doesn't mean you panic. It doesn't mean you become a Formula One racing driver and go to the hospital. That's not the idea. You do have some time. We deliver the baby in about 24 hours if the water bag is broken. But you should head to the hospital ASAP, because in case your contractions have not started, and that can happen, that your water bag is broken, but there are no contractions, there's no pain. So if that is the situation, we can give you medications to artificially induce labor, to start labor for you. And that requires time. So if you arrive at the hospital 20 hours after the bag of waters is broken, you give us very little time to help you to deliver vaginally. If either you or your partner are feeling nervous, if you feel that, oh my God, I can't do this, oh, what's happening? Or your husband keeps asking you, are you okay? Should I remove the car? Should we go? Then nervousness, anxiety, that is one of the worst things that you can have during labor. So if either of you are feeling scared, nervous, anxious, then you should head to the hospital so that the doctors and the nurses can calm you down, right? In case the hospital is very far away, if there's a major traffic jam issue, maybe some road constructions are happening. So all of these things could result in you're taking more time than anticipated to go to the hospital. So look at all of those circumstances when you decide as to when you should be going into the hospital. Once you arrive, what is going to happen? The doctor who is on duty will check you, will make sure that you are in labor. And if yes, then only you are admitted. Once you're admitted, your vital signs are monitored and baby's heart tones are checked. So, these are the things that we are going to want to check and be sure of. After this, if everything is normal, then labor is allowed to progress naturally. We don't really sit with you. We don't really keep holding your hand and saying, it's okay, it's all right. Our job is to only make sure that your vital signs are normal and your baby's heart rate, etc. is normal. In the first stage of labor, the first thing that the cervix is going to do is it's going to efface, which means that it is going to shorten, right? So this long, thick and tightly closed cervix will start becoming shorter and it will become paper thin. So here we go, long, thick and tightly closed. And the first thing that it's going to do is it's going to become shorter and completely flat, right? So that becomes the first stage of labor. In the same first stage, the cervix will also now start opening. It has to open from 0, then there's 1 centimeter, 2 centimeters, 3 centimeters, and so on. And finally, the cervix is open to 10 centimeters, right? This is considered to be the size of the baby's head. So only once the cervix is completely effaced and dilated do we say that the first stage of labor is now over and the cervix is ready for the baby to make the entry into the world. In the second stage of labor, the mother is expected to push. So as you're expected to push, the baby will descend and make its way out of the pelvis. So here is what's going to happen. As the mother pushes, with each push, first the baby's head will crown. So you'll start, the doctor will see the baby's head and will say, yes, yes, I can see the baby's head. Then the head is delivered. Once the head is delivered, the baby's head flexes in this manner. After the head flexes, the baby is going to do a rotation. So this is what is called the rotation. The body will rotate, which will ensure that there is enough room that with the subsequent contraction, one shoulder will get pushed out. With another contraction, the next shoulder will get pushed out. And then finally, the entire baby is delivered, right? So this is called the second stage of labor, where the baby leaves the uterine environment and enters into the outside world. The labor is not yet over because there is still the placenta, which is known as the third stage of labor. Once the baby is out and the umbilical cord is out, if you've opted for stem cell banking, this is the point where cord blood can be collected for storage, but we're still waiting. So it's collected from the umbilical cord and the baby is kept detached. What the doctor will do is we'll put 2 clamps on the umbilical cord and cut the cord. And then we wait for the placenta to detach itself and leave the uterine environment. The placenta is an organ which was created to support the baby in the womb. Now that the baby has been delivered, the placenta has no requirement or need. And therefore, the placenta will detach from the wall of the uterus and exit as well. What is required for labor pain management, right? The most important thing that you must remember is stress causes pain. The more relaxed a mom is, there is less stress. And if there is less stress, excuse me, there is less pain, right? The less pain that a mom will experience, the faster labor will progress. So it's like a cycle, right? If I'm stressed, I'll feel pain. If I feel pain, my labor will take longer. If my labor will take longer, it will progress slower, which means I'm more stressed, more pain, more tension, and all of that, right? So therefore, the best labor management tool is actually stress management. Now I'm going to teach you some magic tricks to manage labor. And I would strongly suggest make a note of these. If your husband is in this session with you, that's fantastic, because many times women don't remember, right? It is the support people who have to remember all of these things. So if your husband is there, make sure that he is kind of, I'm sure he's making notes. If he's not there, you make notes and you explain it to him. Because during labor, your partner or your birth support person will be able to remind you of these things, which will actually help you to manage labor, make labor go faster, make it a much more pleasurable experience. So the first thing that I would recommend, and I'm sure your husband's going to be very happy with this one, is avoid screaming. Okay? And to help you understand this a little better, we're going to do a little quick exercise together. Okay? So just relax, close your eyes, sit back, breathe normally. Wonderful. Keep your facial muscles relaxed and think about what your vaginal muscles are feeling like. Now, the next thing you're going to do is smile. Put a nice and big, relaxed, happy smile on your face. Okay? And think about what your vaginal muscles felt like when you smiled. Now you're going to change this and frown. Make a nice grumpy face. And think about your vaginal muscles. And the next thing that you're going to do for me is you are going to scream. So at the count of 3, I want you to scream. Okay? So don't worry about what it feels like, what people around you are going to think. We're learning. Okay? So let's try it together. 1, 2, 3. Ah! Did you try it? Did not? So let's try it now. And this time when you scream, please think about your vaginal muscles. Okay? 1, 2, 3. Ah! Tightened? Did you see the difference? Now just smile again. Feel the difference. So from the smile to the frown to the scream to the smile. So smile, frown, scream, smile, right? What happens is that the vaginal muscles respond to how your body is, so responds to how your facial muscles are also. So if you get tight, you are going to definitely slow labor down. And it's really important that you should relax yourself and try and avoid screaming and shouting. Also, screaming is going to take away a lot of your energy, and you want to conserve that energy for labor. If I'm not going to scream, then what am I going to do? I am going to breathe. And the way we do our labor breathing is short breaths. So during the pregnancy exercises, I taught you deep breathing. And then now today, I'm going to teach you labor breathing. So close your eyes, place one hand on your chest and place the other hand on your abdomen. Sorry. Yeah. Place one hand on your chest, place one hand on the abdomen, relax your body. Practice this with me. We'll try 2 contractions of 30 seconds each. And then I'll tell you how you're supposed to practice it. Okay? Let me time you. Ready? Take a deep breath in. Exhale. Breathe in through your nose, blow out through your mouth. Short breaths, only to the chest. It looks something like this. And the contraction is disappearing. Take a deep breath in and relax. Keep your eyes closed. Let your shoulder muscles loosen out. This is your period of relaxation. Remember when I showed you the contraction chart? So you have to conserve your energy. Relax yourself. Make yourself go loose, calm. Stop thinking about what's happening around you. Don't worry if the doctor's not there. Just conserve energy so that you can cope with the next contraction. And you can feel another contraction coming on. Take a deep breath in. Exhale. Breathe in through your nose, blow out through your mouth. Short breaths only to the chest. The hand on your abdomen should barely move. It's only the hand on your chest which moves. Breathe, blow. Breathe and blow. Breathe and blow. Breathe and blow. That's the focus. Okay, keep going. And the contraction is disappearing. Take a deep breath in and relax. Okay, wonderful. So what I did was 2 cycles, and what I want you to do is 5 cycles. Okay, once you enter week 28, you should do 5 such cycles every day with that auto suggestion to yourself that my contraction is starting, I have to focus, manage it with my breathing, don't scream, all of those things, right? When you're practicing, today we did 30 seconds. In the beginning, you can start with 30 seconds, but ideally, each of your practice cycles should be 60 seconds. So 5 cycles of 60 seconds each with 5 breaks of 60 seconds each. This is something that you should be doing on a daily basis starting from week 28 onwards. The third thing that I would want you to do is visit the bathroom. So remember I told you that pelvis has 3 important organs and the bowels have emptied themselves out. So now it's time to empty the bladder as well. So that will create more space for the baby, right? So this is your birth canal. On one side is the bowels, on the other side is the bladder. Because the bowels are emptied, we now have more space here. And if I send you to the bathroom to urinate every 45 minutes to an hour, this is going to create more space for the baby to come through better as well. Another good advantage of urinating frequently every 45 minutes to an hour is that at least at that point of time, you will be able to relax. There is no way that you can pass urine without relaxing. So you will sit on the pot, and when you let go and when you release your bladder, just for those few short seconds, your body is very relaxed, and this also helps and contributes to labor moving along much more faster. Being in an upright position is definitely helpful, right? Because it helps you with the advantage of gravity. If this is a mother lying down, this is her uterine end, this is the vaginal end, the baby doesn't have to do a straight journey like this. The baby actually has to do an upward journey. So when the baby leaves the uterus, the baby has to kind of do a climb and then come out of the vagina. So this obviously becomes very difficult and it takes longer. Also, when the mother is in an upright position, that whole descent of the baby from the uterus to the opening of the cervix, etc., becomes much more faster. So whenever possible, I'm not saying all the time, but do try to sit up, be in an upright position, as that will give you the advantage of gravity. Moving around is also definitely helpful. So if you do not have an IV attached to you and if movement is a possibility, it will actually help to wiggle that baby down. So think about it like this. If you have a big, fat, tight pillow and you put a very small, tight pillow cover on it, if you want to remove it, what will you do? You will shake that pillow, you will tug at that pillow, you will tug at that pillow cover, you'll do all of those things, right? So you will provide some form of movement. So walking, squatting, swaying, lunging, all of these things can be movement options. You can also think of using an exercise ball. So that also becomes things that you should use during labor wherever possible. Massage can be a great tool during labor and it can help to release oxytocin, which is a good hormone. So good touch, if it's something that you're enjoying, can actually help you to speed labor along. So one of the areas that mothers love a massage is on the lower back because that's what's hurting. So when a mom is leaning against a chair or a birth ball or on her bed, she could get a nice lower back massage by her partner. Neck and shoulder massages are always welcome. And during labor also, it helps to, increase the good touch. So your partner can do a nice firm neck and shoulder massage for you during labor as well. Some mothers might like to get their belly rubbed, and this should not be a hard massage. This has to be gentle. So it might feel good to get a nice belly rub during labor as well. These are some of the natural pain relief options. Relax. So just kind of, keep yourself calm. Practice your breathing exercises. Have your partner do a little bit of massage during labor to get some good touch and oxytocin flowing. You can also do imagery. A lot of mothers kind of, imagine certain situations, paint certain pictures for themselves, think about pleasant memories. Think about your baby. So these can all be good imagery options. And then there is diversion technique. So when I'm saying diversion, whatever helps to distract you. So maybe chanting certain mantras, maybe, playing with those beads that a lot of people do, maybe listening to music, watching your favorite TV shows. All of these can be good diversion techniques which can be used to manage pain during labor. Before eating and drinking during labor extensively, please check with your doctor. It's a good idea to sip on water or suck on ice chips because you don't want to keep drinking large glasses of water. You might end up throwing up. So keep sipping on water to keep you hydrated and it will cool you down because you're in labor. So your metabolism is really high. You can also try high sugar foods in tiny bits, such as glucose water, sweets, glucose biscuits, small pieces of chocolate. These are all sugar intense items and they can help to increase your energy levels with small bite sizes. If you eat large meals, you increase your incidence of vomiting because you're in pain, discomfort, and etc. And also, it can be really risky if by chance you need an emergency surgery. There are some pain relief options available medically as well, and they are considered safe to use. There is epidural analgesia, which is used for natural labor. So if you need some pain relief, if labor is lasting too long, if it's becoming really difficult, you're getting exhausted, then you can opt for taking an epidural analgesia, which will help to take the pain away. It will help you to relax. It is given in the lower back, but it's not going to affect your spine. There are all sorts of myths around, epidural analgesia, which we don't advocate. It is called a painless birth, but it should be taken as and when needed. It should not be the norm for you. It shouldn't be that I'm saying, oh, I am going to take it. See how labor treats you. It is possible that labor is not very difficult and it's manageable, and maybe it's like mine, which is short. So then you don't need this as an option. In case of surgical birth, they will use what is called a spinal block. So it's similar procedure to an epidural, but it's given as a single shot and also we need total pain relief because it's going to be a major surgery. Both of these options are used very extensively in all lower body surgeries. So all of the myths that are surrounding, the analgesia given in the spine are all that, just myths. We don't get back pain, etc., because of them. It doesn't cause permanent problems to the spine. So all of those are just myths. And if you absolutely need it, then it's an option that you can consider. Enternox is known as laughing gas. It's a combination of nitrous oxide, and they are both natural gases, but this is generally used for very short-term relief. So, it's quite possible that you're almost fully dilated. You just need some help for half an hour or so. Then the doctor might be able to, suggest this as an alternative. But otherwise, if it's for a longer duration, then an epidural analgesia is much more recommended. Surgical birth, it could be a planned surgical birth where there are pre-existing conditions, like maybe the baby's position, the position of the placenta. Maybe there are maternal or fetal conditions which require that you plan a date. And if that is the situation, then you will plan a date a few days before your expected due date. So we don't want you to go into labor at home. We don't want to create any emergencies. So the doctor will ask you to pick a date when she feels that the baby is now ready. Here you are welcome to choose a date of your choice, the time of your choice. All of these are options. It's absolutely okay, right? In case it's an unplanned, that means you go into, everything is fine, you go into natural labor, but the cervix does not dilate, maybe the baby does not move down, there is fetal distress, or at the time of labor, the mother develops a fever, so there is a maternal infection. So these could all become reasons for last-minute surgical births. And don't worry, the medical team is quite prepared to actually deliver a baby in less than 4 minutes if necessary. So if it's absolutely essential, it can be a life-saving procedure. And we say always that a surgical birth is to save lives. It should not be taken as an option for convenience. My mother can come at this time, or my husband has leave on this day, and I like this day better. Those are not options, right? So please don't look at surgical birth as convenience. It should be only from a medical perspective, and the decision to do a surgical birth lies only with your doctor. You have to remember that birth is a new beginning, and you must welcome it with absolute positivity. When you look at that baby, that's the first thing that comes to your mind is, oh, and that's exactly what birth is. It brings your baby into this world. And we should not look at it as, oh my God, something to dread. Look at it as a positive experience.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
So that was a little video presented by Cordlife related to stem cell banking. If you would like to learn more about stem cell banking and the options available to you and understand it better, then you can get in touch with the Cordlife team for a presentation. They will give the presentation to you either on an online platform, or if you wish a personal one, then that's also an option. So you can ask all your questions and clear all your doubts. For all of you mamas today, all you special moms who have attended this session, we have a little gift for you, which comes to you from Cordlife and Mom to Be. Mom to Be is a brand which deals in making maternity a fun and pleasurable experience and gives you shopping pleasures even during maternity. So whether you want to buy maternity dresses or you want to buy maternity pants, or if you think that, oh, I want that really comfortable pillow that's right there and sleep as if I'm in a cocoon, that's also an option that you can consider. So the Cordlife team will be in touch with you about 48 to 72 hours after this session, and will share this voucher with you so that you can do a little bit of shopping for yourself and indulge yourself during your pregnancy. These are books which are available on Amazon, and they are written by me. The first one is Prenatal Fitness, which talks about everything to do with fitness. So we have diet charts for different trimesters and postpartum, exercises which have been explained with pictures for pregnancy and post-delivery. We've also done exercises for mothers to do along with their husbands during pregnancy, and exercises for moms to do along with their babies post-delivery. So that's something that you should definitely consider getting. Parenting Mantras gives you a lot of parenting related information. So from breastfeeding to toilet training to teething to vaccinations, it's that quick reference guide for all parenting questions. So this is also available for you on Amazon. And then you have the Supermom's recipe book. So when your baby starts eating solids, then this is something that you could consider picking up for yourself as well, because you can try some yummy dishes for your little one. I'm really happy to answer any questions that you may have. I have put my personal details up here from Instagram. So I've changed my Instagram handle to @Sonali Shivlani now. So the Instagram and Facebook, so Facebook stays Baby 360 Degrees, but Instagram we've changed it to @Sonali Shivlani, made it a little bit more personalized. YouTube is the Pregnancy Coach by Baby 360 Degrees. So make sure you follow and subscribe, because we do a lot of fun stuff. In addition, I've also mentioned all the Cordlife numbers here. So there's a calling number, there's a WhatsApp number, a toll-free number, and an SMS number. So you might want to make a note of these so that you can remind them to give you your gift voucher. You can remind them to share the recording of this session. I'm sure your husband, if he hasn't watched this or is not with you right now, he would love to go through this content, because it will be very helpful, in terms of the actual delivery date, because they will also know what you're going through and how they can support you best. Okay, so make a note of all these contact details, and I'm going to open up the question box now to answer all your questions. As far as becoming a member of the group is concerned, please get in touch with Radhika, or you can get in touch with Shahina. Shahina is from the Cordlife team, and she coordinates the sessions along with the Agarwal Nursing Home team. So you can get yourself added to the group. As far as the recording of the first session is concerned, I mean, that's a question that the Cordlife team will be able to answer. I would not be able to answer that. If there are any questions related to labor, delivery for today's session, please do post them in. I would also love to get some feedback on the sessions that we have been conducting for you. So if you've enjoyed the session, if you'd like to give us some feedback on what your experience is, you can also give us feedback on the chat group that we have, on the WhatsApp group that we have, so that it will help to motivate other mothers to also be a part and parcel of, joining the sessions then. Are there any questions? I'm happy to answer any questions related to labor and delivery. Also a reminder, our next session is going to be on post-delivery related issues. So it's going to be on breastfeeding, baby care, etc. So you should keep all your questions, any doubts that you have also handy so that you can take full advantage of the session.
I'm on 31st.
Yes, it's on the 31st. I did say that in the beginning. And it will come, the reminders. Shaina is very regular. She puts the reminders in the group as well. So that's a good person to stay in touch with because she will remind you of the sessions as well.
I guess no more questions, so we can close.
Okay, enlighten us. There's one question on side effects of C-section. So, that's a very loaded question, honestly. So C-sections, if they are not required medically, it's a major abdominal surgery. So it should be avoided. It obviously leaves a scar on your uterus. The recovery time is longer. It can result in future pregnancies having a little bit of a risk factor because there is a scar in the uterus as well. So that becomes obviously, issues. There is chances of infection because it's a major surgery, so post-operative infections, etc. are there. A little bit breastfeeding can get delayed because you're in an uncomfortable state, it's hurting you, and etc. If in case you have a general anesthesia to get a C-section done, then you don't get to bond with your baby immediately. So that kind of becomes something that has to be monitored. So therefore, if it is required medically, then yes, there is no choice, right? We're trying to save a life. Then we don't worry about the scar or the recovery period and etc. We take care of all those things. But if it's just a matter of choice or convenience, then you should definitely not opt for a C-section. Ma'am, as far as the earlier part of the session is concerned, you will get a recording of the same. I have been spending quite an extensive amount of time on each of the topics, so it's going to be really difficult to repeat the entire content. So please watch the recorded video. Thank you on that. And just as a request from other sessions, just join in on time because it's good to get a lot of interaction more than anything else, right? We get a lot of questions from you basis what I have covered. Thank you so much. Your feedback is highly appreciated. It makes my day when I get positive feedback from your end. All right. So thank you so much. We will be in touch with you. The team will be in touch with you for the recorded versions and your voucher. Thank you very much for your patience joining us on a Sunday afternoon. Have a great lunch ahead, have a great day ahead, and have a positive birth experience and a super pregnancy. Thank you and good day.
When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.